Hello, everyone. Afternoon. I don't get many occasions to introduce lieutenant governors. Poor boy, I grew up down there in Bed-Stuy, New York, before Bed-Stuy was Bed-Stuy, right? And so I often think about my mother and father would look at me and say, well. So really, it is really a tremendous honor to be able to introduce, and I know not introducing you to somebody you don't know, but Lieutenant Governor Gilchrist. Thank you so much.
All right, good afternoon, everybody. It is definitely a privilege to be here, and I say, Dr. Puckrein, please don't sell yourself short. The National Minority Equality Forum is doing really life-changing, game-changing, community-changing work all across the country, and we're proud to have you here in the state of Michigan, in the city of Flint today, to help us make sure that people in this community recognize that we are all invested in our collective health. We are all invested in making sure that the conditions are created for people to have what they need to be healthy, for people who may be more susceptible to health challenges through no fault of their own. And this city perhaps understands that more than most in the country, but I want everyone to know, and you to know as partners, that myself and Governor Gretchen Whitmer, all those of us in public service, like whether they're in elected office, whether they're in community service, leadership here at Burston, we all have a role to play in making sure that everyone has what they need. And that's really what this fair, I believe, is all about. That's what the resource for people being able to come and get food and other things that this is all about, is making sure that people can be their best. And ultimately, that's what our whole job is. And I think it's appropriate that we come here today on the day that we recognize Dr. Martin Luther King and his life and his legacy. And really, there are so many principles that tie every word that he said, every word that he wrote together. But one of them is the fact that we all, because we are people, have the right to be ourselves. And being yourself in part means being your best, and that means being healthy. That means having access to opportunity. That means the right to not be discriminated against or to be hated because of who you are, what you look like, who you love, how you sound, how you worship, or where you're from. And so today, the connection of that literal fight and struggle for justice, rights, equity, and equality, when combined with the struggle that too many in too many communities go through just to be healthy, it only makes sense that those intersect here in Flint today at Burston. And so, Governor Whitmer and I, we're going to do everything we can do with the tools that the voters of Michigan have blessed us with to make sure that this can be possible, not just in Flint, but in communities all across the state of Michigan. We have been proud to make historic investments in our public health infrastructure over the last 4 years we've been in office, supporting all of our medical professionals and healthcare workers and making sure that they have what they need to, one, be respected and protected, because I think there's been unprecedented disrespect and threat made against medical professionals in the last few years, but also that the systems that they work with, they can be resourced. Those who are doing research to bring forward new treatments, new medicines, new interventions, that they can be well supported as well, so that Michigan can continue to be a leader in not only healthcare delivery, but healthcare innovation. That means that we can then use all of those tools and mechanisms to address the disparities that are, I think, on the front of so many people's minds here today. Michigan was different than other states in how we approached COVID-19 and recognizing and putting at the front the fact that people of color and Black folks in particular were at higher risk of dying from COVID. And we decided that we wouldn't be apologetic about doing something about that. And so I chaired the Michigan Coronavirus Task Force on Racial Disparities that led Michigan to be the only state to eliminate the disparities across race and ethnicity of COVID-19 mortality in the country. And that did not happen by accident. That happened because of community partnerships. That happened because of excellence in execution when it came to testing at neighborhood sites like Burston Playfield. That happened because of the work that we did to make sure that vaccines were available in the community and that we took vaccines to people literally, including here at Burston, where right there at half court I got my second vaccine dose. We have an opportunity now to continue to be a model for the country and how we address and improve health outcomes, and I'm proud to do that work. Just a couple of more numbers to share about the state of Michigan's approach to dealing with disparities. We have a program called Healthy Moms, Healthy Babies that we fully funded that deals with the fact that Black women are 3 times more likely to die from pregnancy-related conditions or complications than white women. The Healthy Moms, Healthy Babies initiative has been expanded by $20 million, benefiting an estimated 35,000 pregnant women across the state of Michigan. And just on Friday, we announced part of that program, which is the expansion of Medicaid to cover doula expenses, something that is more accessible to many women of color. That's just an example of how the work that we want to do and the way we're going to invest the unprecedented resources available to the state of Michigan for the betterment of our people. We also, for all the community health workers in the room, have invested more than $28 million in supporting and expanding community health worker access, and $85 million to improve access to dental care in the state of Michigan, especially for Medicaid recipients. Dental care is very expensive, and there can be fewer things that are worse to happen than having something wrong with your teeth. Like, seriously. And so this is something that can make a difference in the quality of life for tens of thousands of Michiganders. And that's why we prioritize that in our previous budget. So we have more work to do, certainly. But I want folks to know that this will continue to be a priority of our administration and of our service, and one of the things that we will count as a marker of success when we look back upon what we've been able to do collectively and together. So thank you so much for having me here today. God bless all of you and the work that you're doing in the community, and we have so much work that we can accomplish when we choose to do it together. Thank you.
I understand there's a representative from Senator Stabenow's office, please.
Thank you so much for having me, sir. Thank you. Now, I feel like this was set up for the lieutenant governor, because I'm a bit, I'm a Flintstone, but, rep proudly. Well, good afternoon, everyone. I'm a Flintstone, so a little bit of call and response is helpful. Good afternoon. Good afternoon. Bring you greetings on behalf of U.S. Senator Debbie Stabenow. I'm a regional manager for the Flint area, but also serve 9 counties, which equates to 1.5 million residents, from Genesee County to Midland, Shiawassee, and also have the Thumb region. Before I proceed, I would like to thank the National Minority Quality Forum, Exact Sciences, and Meridian for organizing and supporting the Flint Community Cancer Screening and Health Fair. Let's give them a round of applause. And I don't see him because he's wearing a pink tie. Mr. Woodson. I also want to thank Mr. Arthur Woodson and other advocates for making this day possible. Also want to make sure I note that during the Congressional Black Caucus Foundation's annual conference, Mr. Woodson actually attended the Michigan Senators' breakfast, and he actually had the opportunity to provide an update to Senator Stabenow, and he actually was able to witness the senator giving me a directive to continue to be engaging and continue to have conversations with him about how events like this one and more in the future can come to fruition. So I want to make sure I acknowledge him and all the other advocates as well. This health fair, of course, is one of many new actions and collaborations that demonstrate progress toward the cancer moonshot goal to decrease the death rate from cancer by at least 50% over the next 25 years. Cancer has impacted virtually every American family in one way or another. As a Flintstone and congressional staffer, I've had my share of family members who have died from cancer or are currently experiencing challenges and are on their road to recovery. Health fairs like this one and regular screenings are what help to increase the probability of survival. And before I do this, I want to make sure I acknowledge my mom, Ms. Tanya Washington, who is here, because she's the reason why I can actually vouch for those regular screenings and preventive measures because of my mother, who is a survivor. And so, Mom, I thank you for your perseverance and your strength and continued advocacy to continue to press to encourage men and women in our family to get regular screenings, and also encouraging me as well. One of the most important preventive measures is nutrition, of course. We all are very familiar with nutrition and the impact that it has on our mental and physical health. Recently, the United States Department of Agriculture's National Institute of Food and Agriculture launched the Agricultural Science Center of Excellence for Nutrition and Diet for Better Health, and some of you may know it as ASCEND for Better Health, in support of President Biden's cancer moonshot effort to end cancer as we know it. As the chairwoman of the U.S. Senate Committee on Agriculture, Nutrition, and Forestry, Senator Stabenow was happy to help secure $650,000 for the North Flint food market to improve access to healthy food options, and she will continue to support programs that provide healthy food options in communities like Flint, of course, until January 2025, which we can actually say that now. I'll end with a quote that reflects how I'm feeling today, like I said, as a Flintstone and as a congressional staffer. Real appreciation must flow from the deep seas of the heart, Martin Luther King Jr., and from the bottom of my heart, I personally want to thank you, your family and friends, and fellow Flintstones for being here today to move our effort forward to eradicate cancer. Thank you.